3% of women reported ever having symptoms of fistula. It definitely needs well-trained nurses to make them recover well. And these patients are special in the sense that they have lost their babies during delivery. In most cases, around 70% have lost their babies. And they are still remembering the circumstances surrounding the delivery.
On reproductive health situations in Pade, I would say there is improvement now if I compare with the situations in the past. We sensitize the community on, first of all, the importance of antenatal. We sensitize them on the danger of delivering with an unskilled person. We hope that with constant community dialogue, they can really improve and they will appreciate the importance of referral to the facilities.
The Ministry of Health has plans. One is to prevent new cases occurring, and this can be done through good antenatal care, family planning services, access to skilled birth attendants, and also access to cesarean sections and other interventions. The second aim is to operate on the cases which have already existed, and we are doing this by building the capacity of our national hospitals, by collaborating with the partners who come to operate with us, and also by giving information to the public so that they can access the services for obstetric fistula repair in the country.
When they did this operation and they brought me back home, after that I started feeling better completely the way I want.
In fact, I'm really praying God because I always trust her. In fact, if I continue with her education, I'm sure she will bring at least a change in my family. And I'm now happy. I'm happy now. Yeah, only praying God for her. And I also want to send my congratulations to those who give assistance during our operation. Really thank those groups very much. Yeah.
Tufusinga safuna buyambi obwo andibadde sikyasomesa kati kuba nali nina obuzibu bw'amaanyi nnyo, abantu bonna bali bajja kitegeera ate nga nali kikuumye nga kyama kyange. Nasobolanga okugenda era n'omwami wange teyalina buzibu, yangumiikiriza kale mu kizibu ekyo ntubeera ffenna, naabanga mpa bulungi obuyambi, tubeerawo nakati tuli ffenna.
Kintu kino kale twakibuulirako nze ne mukyala wange, yakimbuulira ne tukisirikira nze naye, era nga tewali n'omu akimanyi, nga ne maama waffe takimanyi. Ne ntandika kale kuba nti omukyala ng'oyo muba temwayawula bisenge, temwayawula buliri, nemba nga saamwewala. Oba gamba nti ngende ebbali ng'eyo ne tubeerawo. Nagumiikiriza okuba mukyala wange nali mwagala.
Nsobola ogusibira essaawa ebbiri oba essatu. naye luli ekitaasoboka nga wadde obutikiti.
Everyone has a role in terms of helping to prevent fistula and end fistula at the community level and at national level. The community play a very vital role in terms of their commitment to end maternal mortality and maternal morbidity. So it's very important for us in UNFPA to work with the Ministry of Health, with the regional hospitals, with the NGOs and the faith-based organizations to help bring up the capacity and accelerate the skills in the medical field to be able to operate on many, many more women. So for UNFPA, the stories are really stories of hope. They are stories of people who gave them tender love and care during a time of immense need. And they are people, 3 young women, who have been restored and been reintegrated to the communities, as you will hear, or as you have already heard from their stories. Those are the stories that we want to get out, and those are the stories, the tragedies that we want to prevent in the future.
The Ministry of Health faces a number of challenges. One, we still continue to get new cases. So new cases are occurring and it gives a big challenge. Secondly, we don't have enough capacity, especially in terms of surgical skills, to do all the cases in the country. But we are getting around this by training people. Thirdly, we need equipment for those are specialized services, so we need special equipment to operate the cases. And until some time, this has been a problem, but I'm glad to say that now the UNFPA has assisted us to acquire some equipment which have given to the regional hospitals.
Nedda musawo nja kutuuka ekiseera nfumbirwe naaba njagadde naaba nteredde omulungi.
Right now, as I speak, I am fully okay, and I can even cook. I can sit in the class. I can fetch water. I can do everything now, of which I could not do before.
Bwe nafuna okusooka nga nvudde mu kizibu ekyo nenzaalayo oli bebi noono naye nga nongoosebwa bulongoosebwa kati.
Kyempabula abala abasajja ng'abo abakyala baba bafunye obuzibu ng'obwo babe nga basobola okugumiikiriza, kubanga amalwaliro gye gali agasobola okuwonya ekirwadde ng'ekyo, bagumiikirize okutuusa mukyala bwe lwasobola okuba nti awona.
Takunobere muhuma wange ndiegoromoro munyanja riru muhuma wange.
I'm now okay, and I'm right, and I'm fine. My life is back to normal, and I'm back in school.
Likafunjo ako munyanja muhuma wange, niko basikise mikono yombi muhuma wange. Ngaya